most women are managing more than they're letting on. Sleep isn't what it used to be, weight that maybe isn't responding the way it used to, and oftentimes a nervous system running on empty, even when nothing is technically wrong. And they're all doing it quietly alongside everything else because nobody has given them the language or maybe the support to do anything differently. So today on ZZ Exchange, we're changing that. Welcome back to ZZ Exchange, this is short form conversations where I sit with experienced leaders and professionals and think out loud about how leadership and life actually works, including maybe the parts that don't make it to the highlight reel. So hi, I'm Ainsley, executive coach and founder of Zen Zero. In my work, I sit with women navigating transition, identity, and the quiet cost of staying at the top of their game. And the conversation I have most often underneath all the strategy and the goals is about how women actually feel in their bodies, in their energy, and just in themselves. And today I am super excited because I'm joined by the fabulous Dr. Jolene Kennett, a naturopathic physician, UBC and CCNM graduate with prescribing rights and clinical depth that just goes well beyond what most people imagine when they hear the word naturopath. And what I love about Jolene is she takes a really whole person approach, I know because she's my naturopath, and she really looks at what's actually happening underneath the symptoms. She really builds a plan around the individual. And I love her kind of philosophy, which we will dig into, which is working with tools rather than treatments. And I think that distinction really matters, and we're going to get a little bit into that. And Jolene is also who I started hormone replacement therapy with. So this is a conversation I've been really wanting to have on ZZ Exchange for a while now. Jolene, welcome.
Thank you. Wow, what an introduction. That's incredible. Thanks, Ainsley. Thank you. Thanks for asking me to spend time with you today.
No, that's awesome. And thank you for agreeing to do it because I know this is a little out of the comfort zone as well. Yeah. Yeah. I promise we'll make it painless.
Okay.
But what I wanted to kind of start with is I think that most women arrive at perimenopause or menopause with very little preparation for what's actually happening in their bodies. Like, I think back, like, my mum didn't really prep me for this. My older sisters didn't really talk to me about it. And as we all know, research on women's health is not quite the same as it is for our male counterparts. And I think the symptoms are really real and really impact your life in lots of ways. And I have personally found that oftentimes the general medical or the standard medical response is kind of inadequate. And I think that understanding the underlying biology really changes everything. So my first question for you is when a woman kind of comes to you sort of feeling off, maybe she's not dramatically unwell, but she's just not herself, where do you start? What are you actually looking for? How do you start to dig into it?
Oh, where do I start with a fresh patient? I often ask them to take me through their day, to take me through their standard day. I like to get an understanding as to how they operate. And, we go through different decades of our life and we operate. Sometimes we don't change the way we operate. And so I'm always trying to figure out where a woman's at now, how she's conducting her day, and seeing if that is interfering with her performance.
I remember the first time you did that with me and you paused after you'd written about 20 lines and I was only at about 10 a.m. in my morning. So yeah, it's great to kind of have the mirror held up in that way. And what do you think is the relationship between hormonal changes in perimenopause and kind of nervous system dysregulation? Because that's an area I'm getting more into and it feels like they're very connected, but oftentimes people treat them as sort of separate issues.
That's a good one. Well, what happens to many women in perimenopause is that the rate of decline of estrogen and progesterone changes. And if you want to kind of give a personality to those two hormones, you could think of progesterone as being the Zen Buddha sitting on top of the mountain, all relaxed. And you could think about the estrogen as being that fire, that superwoman, that get up and go, that, getting things done. And so as you get into perimenopause, which there's many ways to describe that phase, but one of the ways I describe it is when the eggs are no longer as strong as they used to be. When the eggs are no longer as strong as they used to be, progesterone can decline more rapidly.
Right.
As progesterone declines more rapidly and you get that gap between Superwoman and Zen Buddha, a lot more anxiety can set in. So when it comes to nervous system dysregulation, I think that one of the sort of emerging feelings that a woman will perceive as that change is starting to happen, and it can happen at 30, 35, 40, 45, 49, 52, right? Every woman's eggs are different environmental exposure, different genetics, etc. But that first sort of intro on nervous system dysregulation is more agitation, uncertainty, difficulty making clear decisions, just having an inability to take that calm seat that they may used to have been able to access.
And it's that cortisol spike too, right? That plays to that.
Cortisol is a big one because suddenly you're losing that sense of calm, and that's very unsettling, very destabilizing. And so naturally the woman goes into a bit of a fight or flight, right? And in getting into that fight or flight state, that's when that cortisol goes up, right? The other side of that,
if it stays up too, that's your weight gain, that's all the different pieces that play in.
Well, yeah, and that cortisol up and the weight gain associated with that is also compounded by the increase in insulin resistance tied to the declining estrogen. So estrogen is declining. It's just not, for the majority of women, it's just not declining at the same rate as progesterone.
Yeah, so it's really important to kind of understand where you're at in that cycle as well.
Absolutely. And it's really important when it comes to perimenopause and having this conversation with nervous system dysregulation and hormones, that we do look at the big picture. Oftentimes we're talking about estrogen coming down, progesterone coming down more rapidly, cortisol spiking, but that also is affecting the thyroid. That's also affecting the blood sugar regulation from the pancreas, our parathyroid glands changing, which controls our bones and our calcium. So you really have
this is why I need you, and women need their own support, because Exactly. If I think as well, back to women in corporate settings or in leadership or kind of those high visibility professional roles who honestly can't afford to appear anything other than composed, not really let it know. I mean, we don't really talk about perimenopause in an office setting, right? What do you see in your patients as the cost of, or maybe people who first come to you as a patient, the cost of carrying that without actually getting the support, both at a person support level with you, but also at a drug level as well, a pharmaceutical level?
The cost of carrying that. So women who have no choice but to perform at a high level and are going through perimenopause and may be unsupported, I think some of the costs of that are the things like family, relationships, social life, their time spent exercising, their time spent feeding themselves, their time spent sleeping, their time spent sitting on the toilet trying to have a bowel movement.
100%. Yeah.
Right? So the cost of, continuing to, I think what you're asking me is what's the cost of keeping up? Is that right?
Yeah, without having the support, right? And from the sounds of it, and I know I experienced that before meeting you, it's just everything starts to kind of give way and the filters come off everything. And I think it's the wheels are coming off the bus, right? But there is actually ways to build that support. And I think part of that is like, you know, if you look at your bio, like you have prescribing rights and clinical tools that I don't think people naturally associate with naturopathic medicine. And so for your patients, what does that change what's possible for them?
So when we decide to access pharmaceuticals to support patients going through different changes, I really present them as something to hold their hand,
Yeah.
something to lend them support, but they have to stay the main character. They have to stay in the driver's seat. I think one of the big differences in how we onboard pharmacotherapy versus how, you know, somebody else may onboard pharmacotherapy is that we're really talking about what has to go alongside this medication, whether it's an adrenaline blocking beta blocker, or it's a progesterone oral supplement before bed, or if it's a topical estrogen patch, or if it's a low dose GLP-1, or if it's pulsatile antidepressant in low dose for a week before their period when things go sideways, right?
Yeah.
We're always talking about using things as support rather than main player, right? So that makes it easier for the patient to offboard. It makes it easier to onboard the medication. It may also result in fewer side effects because we don't have to go to the maximum dose because the patient is still playing an active role. But we use pharmacotherapy to help the patients do what they cognitively know that they want to do, but they're just not there yet. They just need a little bit more.
But I think it's so key, and I love your description of the patient being in the driver's seat, and that's exactly my experience with you as well, going through this, right? It was onboarding little bits at a time and figuring out what worked, but making the lifestyle changes alongside of it, because otherwise you're really just putting what this is, in my terms, like a band-aid over the issue. You're not actually necessarily solving for it. So I think, you know, working with you, it's like helping me become the driver of my own destiny, but knowing that I've got support, like training wheels there to kind of help me as needed, that can be dialed up.
That's a good one. Yeah.
Yeah. No, I think, Jolene, the tools versus treatments is so key. I think one thing though that I do want to touch on is just with hormone replacement therapy, like it has a very complicated public history. And you know, what would you want women to actually understand about it? Like the evidence, the risks, and kind of who is it right for?
Oh, that's a big question and a big topic, and there's a lot of information out there right now.
Yeah.
I think that patients, people in general, need to realize that with any prescription, over-the-counter, supplement, diet strategy, there's going to be risks and benefits. So when it comes to hormone replacement therapy, the patient needs to understand that there could be risks. We never know everything that we're going to know, right? And so when you look at hormone replacement therapy, it's not a one-size-fits-all. It is something that you constantly have to reevaluate to ensure that for you, the risk-benefit equation is making sense.
Yeah.
There's a lot of women who, for hormones, it's life-changing. There's a lot of women who, when they take hormones, their brain goes sideways. And there's a lot of women who take hormones and who don't feel, I'm probably going to get, you're probably going to get comments for this, but there's a lot of women who take hormones and don't notice a damn thing.
I was in the life-changing category, so you'll get a good comment from me.
It doesn't matter what the therapy is. You have to be measuring the benefits. You have to ask yourself, is this therapy helping me achieve this goal? For example, Is this therapy helping me achieve a greater bone density? Is this therapy helping me reduce my Achilles tear or Achilles injury? Is this therapy preventing urinary tract infections? Every medicine can have a complicated history in terms of good and bad, but some women benefit more from, if we're going to talk about the history of hormone replacement therapy and synthetics versus bioidenticals, some women actually have greater benefit from something like Premarin than they do from, which is a synthetic.
Synthetics, bioidenticals, just a 2-minute
Oh,
lesson in what you mean by those.
Sorry. So when you look at hormone replacement therapy, there's what we call synthetic hormones, and then there's what we call bioidentical hormones. A bioidentical hormone is often called natural. I don't think that's the right word for it, but it's still made in the lab, but it's recognized as self by the body. Whereas the synthetic hormone is made in a lab and not recognized as self by the body. So Premarin, for example, let's use that as a hormone replacement therapy example. Let's say Premarin cream. So Premarin vaginal cream is a synthetic hormone cream. It's based on conjugated equine estrogen. So that means horse estrogen, horse pee estrogen. And for some women, they gain greater benefit from that, whilst having more risk associated with that than a bioidentical, but not previously receiving results from a bioidentical.
Right.
So we have to have the conversation. Oh, okay, there may be an increase in bleeding or fibroid growth or, enlarged lining of the uterus, for example. But, how are we going to monitor those risks, and how are we going to line up those risks against the benefits that you're receiving? Yeah, so it's always a personalized discussion of risks and benefits. Are we meeting our goals? What's our onboarding strategy, our treatment strategy? What's our maintenance strategy? And what's our discontinuation strategy?
I love that.
That's what you have. Those are the questions as a patient that you want to kind of map out or have awareness of when you're speaking to your provider.
Yeah, and be able to have that full discussion. I mean, a slight change of tact here, but GLP-1s are everywhere right now. And in the context of kind of midlife and perimenopause and inflammation and all the pieces, where do they fit? Like, is there a conversation women should be having about them in relation to this kind of season of life?
Absolutely. There's with GLP-1s, we tend to see that the side effects are in the dose. So women should be approaching their providers and saying, Jolene, or their providers, and just saying, how does this kind of work into my health plan with my hormone replacement therapy or my other supportive tools? And the GLP-1s in low dosages seem to be supporting that whole dopamine, adrenaline kind of access where the stress and anxiety is high, and there's self-soothing behaviors with craving sweets or craving alcohol or craving chips or whatever. Sometimes the GLP-1s can come in and help to balance that a little bit while that patient is restabilizing. So I see the GLP-1s as having a big role in helping women restabilize their sort of life pattern. Like we started off at the beginning, we talked about what your day is like. Sometimes women have a certain day, but they also have an idea of how their day should be, right? So the GLP-1s can help them get back there. When it comes to chronic disease risk, there's really a lot of benefit for the low-dose GLP-1s from what we're seeing in reducing risk of chronic disease, such as fatty liver, such as high blood pressure and cholesterol, and we may start seeing evidence of it improving or reducing the rate of cognitive decline.
Wow, which is huge, right?
Which is huge. I'm very cautious in saying that, though, because it's...
I mean, I think it's the research that's it's relatively new, right? And it's coming out and it continues to kind of develop. Well, Jolene, I feel like we could go on for hours, but I know that we're coming up to the 20-minute mark. So I do want to just invite you into Coach's Corner, which is like the 3 quick rapid fire questions. And then I'll try and book you for a part 2 on this, I think. But for that, my first question is, what's the one thing that you wish every woman knew before she arrived at perimenopause, and the thing that would change, like how she navigates it?
Get in the best shape of your life before your eggs start losing steam.
Okay, I like it. I failed, but
that's the biggest one. I think that's the most important. And what that translates to medically is get your insulin as sensitized as possible before you hit perimenopause. Because if you're coming into perimenopause with insulin resistance, it's only going to get worse. It's only going to get harder. Yeah.
Yeah, no, I love that. Okay, question 2. For a woman who's been managing her symptoms alone and hasn't yet maybe found the right clinical support, what should she be actually asking for, and kind of like from whom?
What should she be asking for from her provider?
Yeah, or like what should she be looking for if she's trying to find that provider? I mean, I think it goes a little bit back to what you were saying around someone who can talk that full cycle, right?
Yes, I think that when a woman is navigating this alone and turning to adding a team member for support, they really want somebody who's going to look at the big picture, because everything is connected. I mean, this is a far stretch, but I'm going to say it anyways because I'm a bit
Do it.
bold. But I told a patient the other day that if she can treat her constipation, she may get less breast tenderness before her period. So, if you're speaking to somebody who's just looking at hormones, then how are they going to make that connection between constipation and breast tenderness, right?
Yeah.
So you want somebody who's going to look at all of you, everything.
Yeah.
As I say, nose to toes. It's all connected.
Yeah. No, it's so true, and because I have experienced that, it really is. It makes a significant difference with everything. I know for me, just feeling that level of support, it's like, okay, Jolene, in my case, you have the entire picture. Thanks for not sharing it all on here. So when you think of, last question, nervous system regulation, hormones, nutrition, lifestyle, how do you decide like where to start when everything is kind of so connected?
Sleep.
Yeah.
How do I decide where to start? Sleep.
Yeah.
Sleep is often one of those things that's dysregulated first because of the whole imbalance and not just the imbalance, the gap we talked about earlier, but just the roller coaster that's happening throughout the cycle. Sleep is most disrupted, and you can throw anything at a patient. You can throw GLP-1s, you can throw estrogen into the pot, you can throw progesterone into the pot, you can throw testosterone into the pot if you have access to that. You can throw all of these treatments into the pot, but it's not going to work if the patient's not sleeping. And sleep is set up from the moment that patient wakes up in the morning.
Yeah.
So addressing sleep and focusing on sleep means you're looking at diet, you're looking at how they conduct their day, how they plan their tasks. You're looking at everything.
Even their bedroom like process, right? Like their winding down process at night. There's so many things that play into that.
The winding down process, yeah. And the whole day. So I think that sleep is a really good place to start. And then all the little factors around that affect that fundamental rest period that women need, especially high functioning, high demand women.
No, 100%. Sleep hygiene is something I've been working on for a while. Definitely not a pro yet, but a lot better than I was. But yeah, Jolene, wow, I really want to keep going, and I think we definitely have to do a part 2, because I think it's such an important topic that there just needs to be a lot more conversation on, and just I think there's so many questions out there from the women that I even work with on the coaching side. And to those listening, if something in here landed, or if you recognize something in yourself and that whole soldiering on process, I invite you to really take that seriously, because that information is so worth acting on, and the right support exists. You just have to really go and find it. And we'll make sure that we link all of Jolene's work below. So you can drop a comment, you can share it with someone who needs it. You can come and find me at Zen Zero, or Jolene at CareMed Health as well. And as always, subscribe to ZZ Exchange for short form conversations that offer perspective, language, and permission. Hopefully not the pressure or the packaged answers. So Jolene, just thank you for your time today. This was amazing.
That was a lot of fun. I could talk to you about this all weekend.
Great. Sure. Let's do it.